Hello to my online learners. This is a little video to help guide you through the feedback loop of the pancreas because it is pretty confusing. So what I want you to do for the activity for this chapter is to look at the secretions from the pancreas. So, because the secretions from the pancreas work to keep the blood glucose level consistent in the body depending on if you're eating or not eating. I want you to refer to figure 12.9 in the textbook, which is called control of glucose in the pancreas, but do not copy it directly. I want you to create a visual aid to help you learn and remember the secretions and also talk about the liver and the blood, but do not copy it directly. This assignment will be graded on the representation of the integration of the hormones, and also make sure you complete the feedback loop because one will help another. So to help you with this really confusing thing, I'm just going to go through it quickly with you to give you an idea of what's going on. So let's start right here because you start with eating, which is one of my favorite things to do. So after eating, the blood will be absorbing the glucose from the intestines. And as a result, there is an increase in blood glucose levels. The pancreas will detect this insulin level, and it will do three things. It will take the glucose and it will store it into the liver and also into the muscles. It will result in it being turned into adipose and stored, and also it will be taken up by the cells and creating ATP. That will get rid of the extra glucose in the blood. So your glucose level will now be normal. Then you go for a while without eating. Your blood glucose will drop. This will be detected in between eating, the blood glucose level drops. The pancreas again will detect it, and this will release a separate hormone called glucagon. And I remember glucagon is secreted when your glucose is gone. So the glucagon will then act on your adipose, breaking it down and releasing the glucose back into the bloodstream. And it also acts on the glycogen that is stored in the liver and releases that back into the bloodstream. And as a result, you now have a normal blood glucose again. So it's important you realize there are two hormones, insulin and glucagon. Talk about them both. And talk about not only the pancreas, but also the interaction of the liver, the muscles, and the adipose tissue. And please do not copy this diagram directly. Use a flow chart, use some other sort of visual aid, whichever one you work, or some other aid so that you can tell me that you can understand and interpret this. And make sure you complete your feedback loops. Okay, it's out of 6. Basically, you will have 2 for presentation, 2 for talking about what happens when glucose level is high, and 2 for talking about what happens with glucose is low. And if your presentation is not unique, you'll lose those 2 marks. Okay? If you have any questions, email me.